Imagine sitting in a doctor's office. You know the exact vibe, the sterile smell of the room, the crinkly paper on the exam table beneath you.
Oh, yeah, the hum of those awful fluorescent lights overhead.
Exactly. And you're just sitting there waiting for an answer, a path forward. And instead, the doctor looks at your chart, looks back at you, and delivers this single absolute sentence like, we can't treat this here.
Right, or maybe it's that procedure isn't covered, which is just gut-wrenching.
Or the waiting list is 18 months away. I mean, the crushing weight of that moment is universal. You're hit with fear, intense frustration, and this suffocating feeling that your life, your future is suddenly just on hold.
It is a uniquely isolating moment. The systemic failure of a healthcare grid suddenly becomes a very, very personal dead end.
Yeah, but beneath all that panic, there's usually this quiet, stubborn refusal to believe that a local bottleneck dictates the end of your story. And that exact moment of refusal is the core focus of today's deep dive into our sources. We're looking at what happens when your local care runs out.
Right, and specifically, we're analyzing the infrastructure of a platform called PlacidWay. Because if you dive into their foundational source material, their entire architectural purpose is to step into that exact moment of hopelessness.
To be the guide out of the darkness, basically.
Exactly. They act as a guide to map out a world of new possibilities, a calmer way forward. They are proving, at scale, that a systemic no in your city or, your country doesn't equate to a no everywhere else.
Which is such a big deal.
Yeah.
Because we really need to look at the core philosophy driving this. It challenges a very ingrained assumption most of us have. We are so conditioned to view healthcare as this hyper-local resource.
Oh, absolutely. You go to the clinic down the street, you go to the hospital in your city.
Right, you see the specialist in your state. And if they don't have the technology, the beds, or the expertise, we just tend to accept that as an absolute limitation. Like, well, I guess that's it.
Yeah, but PlacidWay is operating on the premise that geography shouldn't dictate who gets to heal. It shouldn't depend on your postcode.
It's kind of like being in a maze, right? Where all the local exits are completely blocked off. You're just hitting wall after wall. And PlacidWay acts as like a drone flying above the maze, showing you that if you just look beyond your immediate borders, there are thousands of open doors.
That's a really good analogy. And the sources show that this isn't some new experiment. They've spent the last 18 years, since 2007, building an alternative to that postcode lottery.
Wow, so they've been doing this for a while.
Yeah, a long time. They've assembled an infrastructure spanning over 60 countries, over 250 cities, and more than 2,000 vetted medical centers.
2,000, that's massive.
It is. They've essentially indexed the global supply of healthcare capacity and just, made it searchable for patients facing local shortages.
So think of it like this. When you buy a house, you don't just hand a bag of cash directly to some stranger and hope they hand over the keys.
Right, that would be insane.
You use a financial clearinghouse, like an escrow service, an entity that verifies the title, holds the funds, and ensures both sides of the transaction are totally legitimate before anyone moves. PlacidWay is essentially acting as an escrow service, but for medical trust.
That's exactly what it is.
They're verifying the currency. In this case, the doctor's credentials, the hospital safety standards, and pricing transparency before you ever have to make a leap of faith.
And that mechanism is so vital when you look at the human impact detailed in the data, because we are talking about over 1.1 million patients who have been guided through this platform.
Wait, 1.1 million?
Yeah, over 1 million individuals who were likely told they were totally out of options locally, but used this trust layer to find treatments globally. They got their lives back. They got their loved ones back.
Okay, wait, I need to stop you there.
Yeah.
Because 1 million patients navigating this sounds incredible on a macro level. But if I'm the person sitting on that crinkly exam paper flying to a country where I don't speak the language for major surgery, that just sounds incredibly reckless.
Yeah. It sounds terrifying, yeah.
Right. Like, isn't this just a massive global budget hunting exercise? Are we just sending vulnerable people to the cheapest possible bidder in unregulated markets?
See, that is the exact hazard of the broader medical tourism industry.
Yeah.
And it is the specific problem PlacidWay's architecture is designed to solve. They explicitly state they are not a discount listing.
Okay, so it's not a bargain hunting travel agency.
Not at all. They function as a trust and discovery layer. Because like you said, when a patient is frightened and vulnerable, introducing risk is catastrophic. They offer clear, honest information without jargon or, hard sells.
So how does a platform sitting on the internet actually guarantee safety in a hospital room in another hemisphere? I mean, what is the mechanism filtering out the bad actors?
It comes down to third-party international auditing. They do not rely on self-reported safety claims from clinics because anyone can say they're safe.
Right. Anyone can build a nice website.
Exactly. So they mandate rigorous accreditations, the most prominent being JCI, that's Joint Commission International.
Okay, we hear acronyms like JCI thrown around in healthcare all the time, but what does that actually look like in practice for the patient traveling abroad? Like, what does that actually mean?
Yeah, so JCI isn't just a plaque a hospital buys for its lobby. It is a grueling, continuous auditing process. It means independent auditors have actively walked the floors of that specific hospital to evaluate hundreds of distinct safety metrics.
Wow, hundreds.
Oh, yeah. They evaluate the exact protocol the surgical team uses if there is a total power grid failure during open heart surgery.
Geez, that's specific.
Right. They review years of data on how the hospital tracks and manages post-operative infection rates. They audit how medications are stored, labeled, and administered to prevent cross-contamination.
Okay, so the platform is using these intense pre-existing global standards as a hard filter.
Yes, absolutely. And they also mandate compliance with top-tier national health ministries, whether that's Mexico's COFEPRIS, Turkey's Ministry of Health, the Dubai Healthcare City Authority, or India's NABH, and Korea's MOHW. The platform does the heavy lifting of verifying these compliance metrics so the patient doesn't have to become a global regulatory expert overnight.
Because who has the energy for that when they're sick?
Exactly. You can view options knowing that the clinic on your screen has already survived a rigorous international safety audit.
That honestly reframes the entire concept of leaving your home country for care. It shifts the motivation from finding the cheapest option to finding the best available option that my local system just can't provide.
Yes, exactly.
And looking at the source material and the types of treatments people are seeking, it totally shatters the old stereotype.
Right.
Like, medical tourism isn't just cheap veneers or minor cosmetic work during a beach vacation anymore.
Oh, definitely not. The data reflects a massive shift toward highly complex, specialized care. Patients are traveling for advanced regenerative therapies, stem cell treatments, intensive orthopedic reconstructions.
Wow.
Yeah, and highly specialized bariatric, oncology, and even fertility care.
But why are those specific high-level innovations available abroad when they aren't available, down the street from the patient?
Well, it is largely a matter of regulatory pacing and regional investment. Different countries heavily subsidize and prioritize different medical sectors.
Okay, that makes sense.
Yeah, like South Korea, for instance, has poured massive resources into integrating robotics and advanced imaging into their surgical theaters. Other nations might approve certain advanced regenerative therapies years before they clear the bureaucratic red tape in North America or Western Europe.
So the patient isn't traveling to get lesser care for less money. They are traveling because the specific next-generation treatment they need is bogged down in local bureaucracy, or their local hospital simply hasn't adopted the technology yet.
Precisely. They are bypassing a local waiting room to access a global center of excellence.
But that global access has to create a completely new logistical problem, right? I mean, if 1 million patients are suddenly looking past their local borders, how are the doctors on the other side supposed to handle, vet, and communicate with them securely? A bridge requires a solid foundation on both sides.
That is a great point. Because you can't just have demand, you need a way to process it.
Right. If the patients are the ones searching for hope, the providers are the ones tasked with actually delivering it. And the platform's message to these global doctors and clinics is fascinating. They tell providers to be the yes someone is searching for.
I love that framing. Because it addresses a fundamental frustration on the medical side, too. Exceptional surgeons are often just as limited by geography as their patients are.
Oh, interesting. How so?
Well, think about it. A leading oncologist in Istanbul or a pioneer in orthopedic surgery in Seoul might have the capacity, the technology, and the life-saving skills to treat more people. But historically, they could only reach the patients who happen to live within driving distance of their facility.
So PlacidWay essentially removes the geographic ceiling for these specialists too. When a local grid fails, a patient in, say, Toronto, London, or Chicago, a top-tier surgeon thousands of miles away gets the opportunity to step in and provide the breakthrough.
Exactly. It's a win for both sides.
But coordinating that, taking a scared patient in one time zone and safely delivering them to an operating table in another, that requires an immense amount of infrastructure.
It really does. And to understand how that logistical hurdle was overcome, we have to look at the founder and CEO of PlacidWay, Pramod Goel. Our sources include insights from his book, which is titled Evolution of Medical Tourism, From Cottage Industry to Corporate World.
That title perfectly frames the timeline, from cottage industry to corporate world.
Yeah.
What did the, cottage industry phase of cross-border healthcare actually look like before platforms like this existed?
Well, in the early 2000s, it was entirely disjointed and incredibly risky. A patient seeking care abroad was essentially on their own. They were relying on anecdotal advice from obscure internet forums.
Oh, wow. Just random people online.
Yeah, exactly. They were dialing international phone numbers, just hoping someone on the other end spoke their language. They were often wiring thousands of dollars to unverified bank accounts, booking their own flights, and just praying that a legitimate doctor would be waiting for them at the airport.
That is terrifying. It's basically DIY healthcare on a global scale. I mean, the anxiety of the medical condition itself must have been compounded by the absolute logistical chaos of the journey.
Oh, absolutely. There was no accountability, no secure transfer of medical records, and zero follow-up infrastructure. It left patients dangerously vulnerable.
So what was the fix?
Well, Goel's thesis in his book and the subsequent architecture of PlacidWay was that this global demand could only be safely met by applying rigorous corporate-level structure. They had to transition this from a fragmented cottage industry into a secure, predictable, highly organized corporate world.
But how exactly did they build that corporate structure? Because connecting a patient in Chicago with a doctor in Seoul requires more than just translating a web page. You're dealing with highly sensitive health data, international privacy laws, and the complex logistics of medical travel.
The solution was building a bespoke technological ecosystem. PlacidWay isn't just a directory, It operates on a secure customer relationship management system, or CRM, that is engineered specifically for cross-border healthcare.
Let's break down how that CRM actually functions, like for the patient and the doctor in real time.
So it acts as an end-to-end encrypted communication hub. In the cottage industry days, you might have been faxing an X-ray to a blurry machine in another country.
Which is crazy to think about now.
Right. But today, the platform allows for the secure, IPA-compliant transfer of high-resolution MRI scans, comprehensive medical histories, and lab results directly into the hands of the vetted international specialist.
So it eliminates the medical blind spots before anyone even books a flight.
Yes. And furthermore, it integrates direct, secure video consultations. So long before a patient ever packs a bag, they are sitting in their living room having a face-to-face telehealth consultation with the actual surgeon who will perform the procedure.
Oh, that's incredible.
Yeah, the doctor can share their screen, walk the patient through the imaging, explain the surgical approach, and answer questions through integrated translation services if necessary.
I feel like that technological layer is what actually manufactures the trust. It removes the terrifying unknown from traveling into the unknown. When you have literally looked your surgeon in the eye, reviewed your own scans with them, and had your entire itinerary mapped out through a secure portal, it stops being a leap of faith.
Exactly. It becomes a carefully orchestrated medical intervention. The digital infrastructure is the bridge that makes the physical journey possible. It organizes all that chaos into a streamlined pathway.
Let's bring this entire narrative full circle to see what this infrastructure looks like in human terms. We started in that sterile, claustrophobic clinic room. You've just heard the doctor say, "We can't treat this here. The local system has hit its limit." But instead of accepting that dead end, you pull out your phone.
Right. You access the discovery layer. You submit your case to a platform that doesn't just index your diagnosis, but actively listens to your specific story.
Yeah, and you review transparent pricing, read verified outcomes from thousands of other patients, and filter for those JCI-accredited facilities. You find a center of excellence in a country you may never have previously considered visiting.
And then you log into the secure CRM. You have a video consultation with a pioneering specialist who reviews your encrypted files and tells you definitively, yes, we can help.
You travel within a structured, vetted itinerary. You receive the advanced care that was geographically locked away from you before. And most importantly, you return home.
You do.
You aren't the hopeless patient trapped in the maze of local waitlists anymore. Because you found a guide that lit the way toward a world of new possibilities. You are looking at a happy, healthy future. You really have your life back.
That journey, from the local dead end to the global solution, is the literal embodiment of their core motto. Way to hope, way to heal.
Way to hope. way to
Yeah.
heal. It is a remarkable shift in how we approach our own autonomy as patients. The platform provides the logistics, the trust, and the transparency,
Mm.
but the ultimate result is simply giving people the power to pursue their own healing, regardless of where they happen to live.
It really is. And analyzing this source material leaves us with a profound, almost structural question about the future of medicine to consider.
What's that?
Well, if we fully embrace the reality that our fundamental right to heal and the technology required to save our lives shouldn't be confined by the borders of the country we reside in, how does that fundamentally change our definition of what a healthcare system actually
Oh,
is?
wow. That's a huge question.
Right. Are we witnessing the very early stages of a shift where we no longer view ourselves merely as patients of a local clinic, but as citizens of a truly global hospital?
A citizen of a global hospital. I
Yeah.
love that. No dead ends, just a much larger map. It completely changes the definition of what is medically possible. Keep that perspective in mind the next time you are told that an answer doesn't exist. Until next time, stay curious.